Hello and welcome to this webinar on connecting people to people, looking at self-assessment tools. This is the fifth in a series of webinars about mobilizing evidence and knowledge. Today, as I said, we'll be exploring self-assessment tools as a method of connecting people to people. This is actually a re-recording of a session that was held on the 30th of October 2017. My name is Alison Day. I will be presenting the session today, and I work as the Library and Knowledge Service Manager in NHS East Dorset Library and Knowledge Service based in Poole Hospital, but I'm also working on a secondment as a Project Manager for the Knowledge for Healthcare programme. So as I said, today we'll be looking at connecting people to people, and in particular looking at a particular self-assessment tool that has been devised to help achieve this. So we will be looking at describing how self-assessment tools can be used to share learning and encourage knowledge exchange. We'll focus in particular upon the self-assessment tool designed to be used by librarians and knowledge specialists with executive teams of health organisations to assess how well an organisation is using evidence and organisational knowledge. We'll also consider how self-assessment can be used within an organisation and how this can help the Library and Knowledge Service to devise and deliver an action plan to use knowledge effectively to meet organisational objectives. So what is a knowledge management self-assessment tool? So according to Chris Collinson and Jeff Parcell in their book, Learning to Fly, it is a way to find a common language in order to share. They devised a set of common operational practices for British Petroleum BP where they worked. They came up with 25 common operational practices and then 5 levels of competencies so teams and individuals could assess how well they were doing and identify areas for improvement. By assessing their own situation, individuals or individual teams are more likely to determine and implement their own solutions. It becomes more than just an audit or a benchmarking exercise. It's not about getting a performance score, but is about encouraging conversations to identify opportunities to share learning and knowledge within the organisation. Teams at British Petroleum were asked to plot their current position or competency level for each of the criteria, also to identify target levels. By plotting these in Excel, it's possible to visualise the results, and that appears in this diagram, which is called a river diagram. It's a quick way to see where there are gaps and where one team can learn from another. Where the river is widest, and you can see that identified from the blue arrow here, that shows where there is a huge opportunity for sharing because you have some teams operating at level 1, but within the organisation you also have some teams operating at level 4. Plotting competency and priority of team assessments on a diagram helps that immediate visual check of how an organisation is doing. The more bank that shows, the more green in the diagram, shows where there's probably a little bit of a gap, a knowledge gap. And it may be that that's when you need to bring in expertise from outside of the organisation to help people to grow and develop their knowledge in a particular area. Another way of plotting the information is to create something called a stairs diagram. This also plots the competency and the priority for each criteria, but it shows how people can be put in touch with other people to help them to attain their target. The knowledge management team can then assist by setting up opportunities for knowledge exchange events using a range of knowledge management tools and techniques such as peer assist, action learning sets, communities of practice, retrospects, or indeed knowledge cafes. So in this worked example, you have Bob who is working at level 4 on this particular criteria of taking a strategic approach. Jim and Wendy are here at level 2, but it's not a priority for their development. They don't have it appearing in the blue target level area. But Dick, on the other hand, is actually currently working at level 2, but has indicated that he would like to reach 2 further target levels to actually feel that he's really achieving in this area. So he really wants to be at level 4. Dick has some options to obtain the knowledge and learning to be able to him to reach his target. He could go straight to Bob and have a conversation with him about how to improve his approach for taking a strategic approach, or he could go to Tom, Harry, Anne, Rosie and Jill's team because they're already working at level 3, and it might be that by doing incremental steps he could work towards level 3, get to where they are, and then move on up to level 4. So as I said, a stairs diagram is a great visual way of showing where people want to get to for their priority target areas and who they need to speak to in the organisation to obtain and reach that area. If you were interested in plotting the results of your self-assessment in this way, either on a rivers diagram or a stairs diagram, there are templates in Excel that you can use to help you visualize your data in this manner. So connecting people to people is described in the Knowledge for Healthcare Knowledge Management Toolkit as relating to sharing learning, supporting innovation, promoting actionable knowledge tools, and helping colleagues to share ideas, question and learn. And it's very clear that a self-assessment fits neatly within this area. With this in mind, based on the work of Chris Collinson and Jeff Parcell, Rachel Cook and others at the NHS Institute for Innovation and Improvement devised an NHS Knowledge Management Maturity Model. In 2017, this was further revised to focus upon how well an organisation uses evidence and shares organisational knowledge. You need to think of this tool in light of, wouldn't it be good if there was a way to review how well an organisation is using evidence and sharing knowledge? It provides an opportunity for library and knowledge services to facilitate a self-assessment session with executive leaders to assess what is working well and what more could be done, to set priorities for better mobilising evidence and knowledge, and to devise and deliver an action plan so library and knowledge services can support and help the board to meet their objectives. What you have pictured on the screen is a screenshot of the first page of the actual assessment, and I'll describe how that works in just a moment. You also have a link to a PDF copy of the full assessment tool that you can download and use. So you may be thinking, why would you even use a self-assessment tool? It's a great way of considering how well an organisation is drawing upon the know-how of their staff and feeding evidence into decision-making. It also provides library and knowledge services with a great opportunity to have a dedicated conversation with a senior leader of an organisation to prioritise the opportunities that the library and knowledge service can deliver to help them to meet their objectives. It's a way of assessing what is working well and what more could be done. And it's about spotting practical initiatives on which librarians can lead. This particular tool was piloted at Surrey and Sussex Healthcare NHS Trust and Poole Hospital NHS Foundation Trust. Some of the feedback was really positive. We thought it would be difficult to get busy senior managers to engage with the tool. We thought it was probably a little bit long, but we're really pleasantly surprised by their level of engagement and the positive response to running the sessions. Senior managers could see the relevance of completing the tool, and at Surrey and Sussex this has led to an invitation for a librarian to regularly attend divisional meetings to remind them of the need to use knowledge and evidence and work on organising divisional policies and guidance, including supply of evidence, organisation, archiving, acting as a guardian and alerting when requiring review. One thing we should remember when we present this tool to our senior stakeholders is that it can be really useful as a preparation for CQC visits. CQC focus upon how evidence is used, and it's great for the board to show that this has been actively addressed in their organisation by using this particular self-assessment tool. So how does the tool work? Well, it consists of 4 sections: leadership, culture and capability, knowledge, resources, and priorities and planning. And there are a total of 20 criteria in all. You'll see the criteria are listed on the left-hand side of the tool. And then you have a scale of capability going along the top. There is then a statement relating to each of the areas of development. and it's up for the individual or the individual team to decide which score most reflects the area that they are working at or the level that they are working at. The librarian or knowledge specialist facilitates the session. They help the executive to review what is already in place, consider which initiatives will make the most impact. They help them to prioritise those initiatives, and then the library knowledge service manager is tasked with drawing up and delivering an action plan. This tool can be used as a discussion in an executive team meeting, or at a board seminar, or in a conversation between an individual chief executive officer and the learning and knowledge services manager. A more comprehensive review can be achieved by each directorate or division completing individual assessments for their own areas. These can then be compared, perhaps entering the data into a river or stairs diagram, so that there can be a real snapshot of how the organisation can develop best practice by identifying where things are working well and supporting areas where further development and learning is needed. The scoring is really quite incidental. As I said at the beginning, this isn't really about scoring a process or giving people a score, an overall score. It's really just to aid people to put a mark on the page as to where they feel they are working. And if people are unsure and tend to fall between two camps, you always score to the lower of those two to help focus people to concentrate on making a decision. So in the webinar, we decided that it would be nice to have a little bit of a discussion activity, and we asked the question, what would you need to put into place before you facilitate the self-assessment in your organisation? Bearing in mind that we're all starting at different places and have different relationships with our senior executive teams. These were the answers that people came up with. Confidence. Staff, enough people to be able to carry out this process. Establishing contact with the board. Being clear on how to describe the self-assessment tool. And there are lots of, the tool comes with a really useful one-page descriptive text on the front, which really sets it in context for people. Linking to improvement work already going on and actually using this tool to support that improvement work. Deciding which group you want to speak to, maybe not to start with the board, but perhaps another team, just to build confidence in using the tool. Developing a patter to introduce it. Again, the introductory page can help with this. Working through it ourselves as a service so we get familiar with the tools and all the techniques which are described, each of the statements, and understanding where we would rate ourselves. A champion to help sell the idea to senior executives. Buy-in from stakeholders. Examples of action plans from others using the tool. And increasing our own knowledge of the tools and techniques being described. Contacts and names of the people that we want to use the tool with are also very useful. So along with the tool, there has been some guidance produced on how to use the self-assessment tool, and the link for that is listed at the end of this page. It's really important that the process is owned by the Library and Knowledge Service. Individual executive directors of the board can discuss it independently, but really to put the action plan into place and to deal with any questions that arise and work with participants on setting priorities, you really need a representative from Library and Knowledge Services to facilitate this work. It's crucial that you familiarise yourself with the tool and especially the list of opportunities in Section 4. You might want to consider local examples of opportunities that you can refer to. You will identify who you will target to participate in the session. You'll schedule the session and time after the session to prepare an action plan and then work on delivering that before then revisiting the tool, say perhaps in a year's time or 2 years' time. Preparation for participants involves making sure that you send through the self-assessment for them to read through in advance so they have time to fully consider the criteria. At the meeting, you would briefly introduce the tool, reiterating its purpose. You help the participants to score each criteria. Reading from left to right, you ask each participant to circle the appropriate level of maturity that they feel their organisation or their team is currently at. You then prioritise some opportunities. You use section 4 to think about what would be the best thing to put into place to make a difference for that organisation. And what is suggested it's not suggested that you do all of those. It's suggested you pick maybe 3, 4, maybe 5 to actually concentrate and take forward. The things that will really make a difference to the organisational objectives. You then identify and agree actions that the Library Knowledge Service will take to address the issues raised in the self-assessment. At the end of the meeting, you summarise key outcomes, thank the participants, and you may organise a follow-up session to actually present the action plan. It would be really useful if, having done this process, you then feed back to your Library and Knowledge Service colleagues in your region or nationally via the Knowledge for Healthcare blog about the process, how you found it, what worked, how it was received, and then you start to deliver your actions. The final section of the self-assessment tool is a priorities and planning area. This is an opportunity for the librarian as facilitator to present a range of opportunities to help the team or organisation to develop, and that is what forms the basis of an action plan. So it may be that in your organisation there is no local innovations forum, and it may be that there's a real drive within the organisation to push forward with innovation. In that instance, offering to investigate and facilitate and help to set up a local innovations forum may be a number one priority. It may be that you have just recently had new organisation come to join your organisation, or you're having to work more closely in partnership with another organisation, in which case it could be that a learning during tool would be really useful. Perhaps running some knowledge cafes or some after-action reviews to share learning lessons between teams would be the priority in that instance. So to look at these in more detail on the webinar, we decided to ask you to have a look at the opportunities and just think as a straight off, which of these would be things that you do already, business as usual, which would extend your role a little bit, things you'd need to maybe develop and put into place. And also we've given you a third column to consider which ones you want to find out a little bit more about, the ones that interest you but you feel you need more information before you could act. So what we asked people to do was to just tick and tell us where they felt they were for each of these opportunities. So unsurprisingly, for literature searching, most people felt this was a business as usual activity. And that was the same pretty much for policy briefing. A few more people felt it was a beyond activity. Alerting services, it seems to be a very, people feel that's within their comfort zone of what they deliver already. And a bit of a mixed bag for horizon scanning. Whereas for local innovations forum, before action reviews and peer assists, we've got more of a spread with more people needing to find out more. With the second page and the tools listed, these are seen as more beyond activities, and again, some people feel they need to find out more. For those that want to find out more about after-action reviews, action learning sets, knowledge cafes, communities of practice, randomized coffee trials, knowledge harvesting, knowledge retention and transfer interviews, it would be well advised to have a look at the Knowledge Management Toolkit on the Knowledge for Healthcare blog. Here are listed lots of definitions of what these things are, with examples and case studies of libraries that have actually put them into practice. Lots of ideas to get you started. There are also the other webinars in this series which have explored some of these items in more detail. On the third page, we seem to have a switch back to business as usual. Research inquiries, everybody who completed the exercise on the call felt that this was a business as usual exercise area. Tailored online resources by special interest. Information and digital skill training to find and evaluate evidence. Again, people feel that these are things they're already delivering. But it may be that your board or the people that you're speaking to in this particular organisation are not as aware of these as perhaps you would like, and that's what would come through from the self-assessment. So doing this exercise may be an opportunity to highlight to senior stakeholders, senior executives, some of the work that you're already doing and that you want to promote and spread wider. Capturing and sharing lessons learned seems to be regarded as a beyond activity, something to find out more about, something we don't generally do, although a couple of people are already involved in this area of activity. Developing a research interest database is pretty spread amongst the three columns, as is knowledge specialists aligned to decision-making groups and knowledge specialists embedded in multidisciplinary teams, a bit of a mixture through those two. On the last page, again, pretty much a spread of where people feel they are with these particular priorities. So again, there would be some work here perhaps to develop work in this area if that is deemed to be a priority for your organisation. Or maybe it's just about highlighting to your organisation work that you're already doing. But this will become apparent when they actually complete the self-assessment. That's when you're able to put suggestions in place for people. And it's up to you as a facilitator to decide which of these would be most helpful for your organisation, depending on individual circumstances. So as a quick recap, we have considered how self-assessment tools can be used to share learning and encourage knowledge exchange. We've outlined why you would use a self-assessment tool. We've introduced the Using Evidence and Organisational Knowledge self-assessment tool and discussed how this has been developed and used successfully in an NHS trust. We've explained how the self-assessment tool works and thought about the action plan associated with a self-assessment. So some things to think about if you're about to embark on doing a self-assessment. Firstly, familiarise yourself with the self-assessment tool prior to arranging a facilitated session. Remember that you can use the tool with any senior staff group and perhaps practice on your local senior team before trying with the executive board so you feel confident. Consider using local examples to illustrate the opportunities. If you run a really good current awareness service or a fantastic lessons learnt bulletin, make sure you share this with the executive team so they're aware of the work that you're already doing in this area, and they may have suggestions on how you can spread that more widely throughout the organisation. Remember that in the pilot, the tool was received enthusiastically. This is something that is of great interest to executives. And don't be put off if the planned session gets postponed. Persevere because people do find it useful. But everyone's busy, and it's about finding the right time to deliver this. So some things to think about at the end of this session and to help you to prepare for actually getting started on using the tool. Think about the opportunity areas that you personally need to find out more about and take some steps to read a bit more about them. Don't be too ambitious. Don't try and find out about everything, but perhaps select the ones that you think would be of most benefit to your organisation. Consider who you will approach first about this in your organisation. Some suggestions from the group that attended the webinar are listed below. Who else will you use the self-assessment tool? Will you do it just with one team, or will you try and do it with several different teams so you can produce a river or stairs diagram to compare the learning throughout your organisation? Think about when you will schedule the facilitation of the self-assessment. Make sure you've got enough time either side to plan the session and to follow up with an action plan. Think about who else you'll contact for further help should you need it. There's no reason why two library services shouldn't group together to help support each other to deliver the self-assessment tool. There are lots of additional tools to help you with this process. As I mentioned before, within the Knowledge Management Toolkit, there are a range of tools and techniques about the various opportunities that are presented in Section 4 of the self-assessment tool. If you're interested in finding out more about river and stairs diagrams, you would do well to look at the e-learning taking stock section, which describes this in more detail, or indeed picking up a copy of Learning to Fly and reading the relevant sections. The actual tool itself, the Using External Evidence and Organisational Knowledge tool, is available at the URL listed. There is also a copy of the activity sheet so that you can ask your teams perhaps to see where they feel they are in relation to some of those opportunities. And there is a prompt card to help you run through the process. There's some information about how the tool was developed and some guidance on how you can actually use the tool. Within the session on the 30th of October, there were no further questions, but of course anyone is invited to get in touch with me if they wanted to explore this further or have a discussion about how they could use the self-assessment tool in their own organisations. Thank you so much for listening. I hope you found the content useful. Please join us for the next WebEx at 10 a.m. on Wednesday the 8th of November, where we'll be looking at connecting people to best practice. And in particular, we'll be looking at developing an innovations and best practice database. And I'm delighted to say that we will be joined by Samantha Unambui from Royal Brompton and Harefield NHS Foundation Trust, who has developed an innovations database and in so doing was successful in being awarded the 2017 Sally Hernando Award for Innovation. So we'll look forward to hearing more about this from Sam on the 8th of November. Thank you for listening.